So for this video, we're going to look at causal relationships, not casual relationships. That's something quite different. The key of causal relationships is understanding cause and effect. And that's a really important element of public policy and also therefore public policy analysis. So again, we're still on step one here. We're defining the problem, but really looking at those causal relationships between the causes of the problem and then the consequences of the problem. And also what are the solutions and outcomes as a result of those solutions. So as we've discussed before, public policies and plans are hypotheses. If government policymakers do X, then Y will follow. And they can be considered causal statements about the effects of government actions. These predictions are contained all over legislative statute, constitutional provisions, or regulations. When political figures are making statements about how they want to address particular problems, they'll say, I'm going to do this, and that's going to have this outcome. Policy and planning analyses are inputs to the process, and ultimately we're interested in testing those causal statements on various levels, whether being descriptive or predictive, whether looking at the world as it is and seeing whether the causal statements exist in that world, or whether they're looking at the world as it could be and estimating or projecting what the world could look like. Now, causal relationships are important for any class in the MPA program. We're often interested in what are the effects of the things that we're doing. But particularly in 506, box and arrow diagrams can be really useful to represent cause and effect relationships, including in multiple regression analyses that are used in that class. So the direction of the arrow reflects the direction of influence. The cause leads to the effect. The independent variables are leading to the dependent variable. Variables x1, x2, independent variables are having an effect on the y dependent variable. The policy or program results in an outcome within society. The diagrams can be fairly simple, like the one we see on the top right here, with only variables and the arrows. So here are independent variables of education, gender, age, and competence are all influencing someone's salary. The diagrams could also be more complex, as we see on the bottom right here, where the variables, which we're calling x1, x2, x3, these variables are clearly influencing our dependent variable of y, but they're doing so at different levels. Some are positively correlated with the dependent variable, and some stronger so, and some are negatively related with the dependent variable. So to continue our example above, more education is likely to lead to higher salary. The gender, that relationship depends. Sadly, males tend to earn more than women, even doing the same job. Age, you tend to earn more as you get older, as you get more experience. And hopefully competence, which is tricky to measure, is also positively related to salary, although I'm sure we all know people who are quite competent and not paid enough, or fairly incompetent and are still paid a lot. So let's think about our research design. Problems are often used to generate research questions. So we might think about a problem in society and develop a research question based on trying to understand or unpack or maybe solve that particular problem. We can also use theoretical frameworks which have been developed by prior scholars to understand these problems or maybe related problems, and use those theoretical frameworks to generate our research questions. And also we think about our hypotheses, which are usually our anticipated answers to our research questions. And these are the first three steps of our social science approach to research design. We then think about our experiment design. How can we create an experiment or an analytical framework so that we can capture some of these cause and effect relationships within our research so that ultimately we can inform our decision makers? We need to think about how we're sampling the data within our research. We need to collect that data, and then we need to analyze that data such that we can discuss and interpret the results, and again come up with recommendations, and so that hopefully we can contribute to debates around causes and effects within this particular issue area. So this is the standard social science approach to research design. So let's think about hypotheses for a moment. Again, recall that policies are in one sense a hypothesis, a supposition or proposed explanation made on the basis of maybe limited information as a starting point for further investigation. So how do you develop a hypothesis? Well, intuition is a good place to start. You probably know a lot already about this issue. You definitely want to undertake a literature review, and I posted another video which focuses on that area. You can also think about logic models. Logic models relate causes and consequences as well as programs and outcomes. And as such, they're kind of a big causal relationship model. We'll go over those in the next video. Each of these areas can help you develop a hypothesis, an explanation or a good guess as to what the answer to your research question might be. And ultimately, you want to be able to test your hypotheses through your research design. So especially in social science, we tend to use research methods to identify cause and effect relationships about societal problems. I say tend to because there are also some research methods that take a different approach, and they're not so much interested in cause and effect relationships, but maybe instead about revealing the lived experience of that particular issue. And ultimately, the aim is to better inform decision-making around problems. So we want to study questions like, does the problem even exist? What is causing the problem? What factors, they could be various different variables, we could call them X1, X2, are influencing the various different outcomes, or our Y dependent variable. What might be done to solve this particular societal problem? Which policy solutions have worked elsewhere? And hopefully we might also be able to test possible solutions to problems, and maybe those solutions might even work. So here's a case study or example of a problem identification, but specifically looking at the causal relationships. So our example is reducing smoking rates in Los Angeles County. And here we can see the adult smoking prevalence by neighborhood, and you can see clear patterns in terms of the spatial relationship between smoking rates and location. And the table on the right shows us the significant differences here between, for example, men and women, or in terms of ethnicity, and also in terms of education. So clearly those that have ended their education at high school level are more likely to smoke than those who have a college or some kind of postgraduate degree. Now, if we want to reduce smoking rates in Los Angeles County, we need to think about some kind of causal relationships here, right? So we might think about a particular ethnic group that might have higher rates of smoking than others. Obviously, we need to test whether those differences are indeed statistically significant to make sure that the problem is indeed what we observe it to be. So for example, smoking in Los Angeles County is higher among Black men in particular, it's nearly a third. So both Black women and Asian American men, it's around 1/5, and then Latino men, it's a little bit more than 1 in 6. And these rates are all much higher than the entire population. And then within the Asian American group, Korean male Angelenos have particularly high smoking rates. These findings allow public health programs, such as information campaigns, on smoking to be targeted specifically towards particular populations, such as Korean males. Moreover, research can then be undertaken to better understand what are the causes of that difference. So maybe there's some cultural attitudes. Maybe Koreans start smoking younger. I don't know. These are just hypotheses about the causes of this particular issue. And more importantly, then, how to address them. So for example, attempting to change cultural attitudes, or maybe targeting adverts in that specific language, or maybe programs in schools in areas with larger Korean populations. And now this research could involve quantitative data about health-related indicators, such as those we've looked at, whether that's smoking rates, income levels, employment, hours worked, ethnicity, etc. But it could also involve qualitative data regarding, for example, the cultural factors related to smoking, the places that people smoke, why they continue to smoke or are not able to quit, and how they are influenced by different smoking cessation campaigns. And throughout all of these ideas, we're thinking again about cause and effect relationships. How can we create programs that have the outcomes that we desire, i.e. less smoking and ultimately longer lives for people who are smoking?